Good morning. I'm Ashley Christian, Director of Investor Development for the Knoxville Chamber. Thank you for joining us this morning. We are grateful to have you all here with us virtually today as we hear from Dr. Mandy Halford, Senior Vice President and Chief Informatics Officer for Covenant Health. Throughout today's presentation, please feel free to enter any questions that you have for Dr. Halford in the Q&A panel, and we will work to answer them as time allows at the end of the presentation. Before we get started, I'd like to take an opportunity to thank the Knoxville Chamber's Economic Development Ecosystem sponsors for helping us bring exciting programs like this one to you. Thank you to the Crispin Company, Mesa and Associates, First Bank, McCarty Holsapple McCarty. We appreciate your support and investment in the Chamber's mission and in our community. At this time, I'd like to introduce our featured guest today, Dr. Mandy Halford with Covenant Health. Dr. Halford was named Senior Vice President and Chief Medical Informatics Officer at Covenant Health in 2021 after serving as Vice President and Chief Medical Informatics Officer since 2016. Her primary responsibility is providing medical leadership across healthcare delivery system in the areas of strategic planning, organization management, process redesign, clinical informatics, innovation, and sustainment of the integrated electronic health record. She is board certified by the American Board of Internal Medicine and the American Board of Preventative Medicine Clinical Informatics. She is an East Tennessee native and received her Doctor of Medicine degree from the University of Tennessee College of Medicine. We are thrilled to have her in our community. Please join me to welcome Dr. Mandy Halford.
Ashley, thank you so much for the kind introduction, and thank you to the Knoxville Chamber for allowing Covenant Health and myself to represent Covenant and present today. I'm very excited to take you through how technology is changing the future of healthcare, and hope that you get to learn some today. I definitely would love, if you have any questions, to get those answered for you as I can. So as Ashley said, I am an East Tennessee native, and the reason I choose Covenant Health is I really want to improve healthcare for patients in my home community. I started off in the Crossville area, which is my husband's hometown, and we were able to move back to Anderson County, which is my hometown, and also serve the greater Knoxville area, which has really been able to help me fulfill my passion and purpose in life. As we start off today, I really want to start off by telling you a little bit about Covenant Health, and then we'll get into technology. I know that virtual care is definitely the hot topic and is extremely important for how we're evolving in healthcare, but I can't really talk about how technology is changing the future without covering these other key components. So I'll take you through a little bit of the evolution of the electronic health record, talk about interoperability and the importance of that as we evolve and improve the delivery of care for our patients, cover virtual care, including some of our newest service lines, then transition to digital advances, diagnosis and treatment, and what things are on the horizon. So to kick off, I hope you know about Covenant Health, that we are a community-owned, not-for-profit healthcare delivery system that is headquartered here in Knoxville, Tennessee. We have over 11,000 employees, physicians, and volunteers that work across our 23-county service area, and we serve over 2 million patients every year. On this map, you'll see our hospitals that range from Cumberland Medical Center up to Claiborne and Hamblin and Sevier counties. Also, you'll see the blue dots are all of our physician practice locations under the Covenant Medical Group umbrella, as well as the gray dots are Peninsula outpatient clinics, and then red are Thompson Oncology. At Covenant Health, we believe in our pledge of excellence. Under our leadership of the board of directors and our CEO, Mr. Jim Vandersteeg, we each pledge and sign a document that we every day put our patients first. We provide excellence in everything that we do, and we do our part to make Covenant Health the first and best choice, ultimately supporting our mission and vision to improve healthcare in the East Tennessee area. We have been recognized for quality, safety, patient satisfaction, and ethical business awards, including receiving the Knoxville Chamber's Impact Award for improving overall quality in East Tennessee. We've been recognized by the U.S. News and World Report, the Leapfrog Group, and the American Heart Association. We've also been awarded Best Employer by Forbes 6 years in a row, and recognized by the Becker's Healthcare as one of the nation's 150 top places to work in healthcare. Our most recent accolade is directly related to technology, and that is achieving HIMSS Stage 7. HIMSS is Healthcare Information and Management Systems Society. It's a global advisor and leader in technology. And 7 is the highest level of technology that you can reach. And we're excited to say Covenant Health is the first in the state of Tennessee to make this achievement, both for our hospitals and for our physician practices. Now that I told you a little bit about myself and about Covenant, I'd like to focus on the topic of the day, which is technology and healthcare, really starting with the core of how we take care of patients, which is the electronic health record. And this has really been an evolution across the nation. What you saw, if you read and look back on history, I feel like history is extremely important as we think about how we improve the future. In the early 2000s, really what was seen is that the business industry began to put a lens on the healthcare industry. And they began to ask questions on why are patients being harmed through the healthcare system. Several articles were published, including the headline of People magazine. You may remember Dennis Quaid and his baby twins who received an extremely high dose of heparin, Time magazine, and then one of the most important articles and books was The Shorter Lives, Poorer Health. And in this paper, what they provided evidence for is that the United States is among the wealthiest nations in the world, but it's far from the healthiest. What this spun was a whole group of new regulations that were aimed to really improve the quality of care for our patients, to decrease cost, and to make healthcare more accessible across the nation. There are a multitude of those regulations, including patient experience, quality measures, readmission measures, hospital-acquired conditions. And then from the technology standpoint was the program called Meaningful Use. As you can imagine, if we want to improve healthcare and we want to really be able to look at this data, that's very difficult to do with physician handwritten notes, physician handwritten prescriptions and orders. And so one of the very first initiatives was focused on data capture and sharing. And this was the movement you saw across the nation for physician practices and hospitals and health systems to adopt electronic health records. Once those electronic health records in place, stage 2 moved us on to focusing more on advanced clinical processes. Stage 3 moved us on to focus on improved outcomes. And then beyond stage 3 is really focusing on true interoperability. So as we rolled out electronic health records, we were on a very short time frame to get this done. And the goal was great and lofty, but the reality is that clinicians and patients both struggled. These were brand new workflows. We had to learn how to document and to order in different ways than perhaps we were taught in medical school or in residency. And so how do we get past that and move towards a more mature approach in caring for our patients with an electronic health record? Well, the key to that is to have really strong physician leadership and clinical champions who partner with the technology informatics team to accomplish these items. you'll notice the curve of adoption. I think this is important no matter if you're implementing non-healthcare technology, if you're implementing a new business project. It's really important to kind of get those early adopters identified first. They know how to embrace change, they're self-efficient, and they're influencers. And if you can get those key champions on board, they really help to bring on the Main Street market. And once you get those onboarded, then you can really kind of follow up on the skeptics and those that have the most difficult time adopting new technologies. We also, in addition to having strong physician leaders, we follow a very framed approach for organizational change management. And the key to organizational change management for any major initiative, including onboarding new technology, is communication. And we start with awareness and then move to a phase of understanding, then move on to absorption and learning, and then we would implement the new product. And then after that, focus on adoption, and then it really becomes standardized and institutionalized across the organization. So let's think for a minute on where we've been and where we're going. We have come a long way. I usually say that caring for an electronic health record is much like raising a child. In the beginning, it needs a lot of nurturing and a lot of feeding. But as time goes on and you work on optimizing the system and improving it, it really becomes more stable and doesn't require as much nurturing. So where we're going with the electronic health record is really getting to true interoperability, both for clinicians and, more importantly, for our patients. And if you can think about that, any new technology we onboard, we have to remember that it's the patient's record and the patient is first. So why do we focus on optimizing the electronic health record? Why do we use this technology? Why do we onboard new things? It's really to keep that patient first. And what we focus on is consolidating the health record and allowing that health record to follow the patient through their entire journey. Our goal is to get out of episodic care and transition to care coordination, where a patient, no matter if they're in their home, if they're in their physician's office, if they have to be seen in the emergency room, or perhaps have to be hospitalized, that record will follow them throughout their lifetime. We need solutions that support mobility. Everybody in this day and age, and we'll show you some stats, is using more mobile devices. And so we have to be able to support that both on the clinician side and the patient side. That electronic health record needs to be clinically integrated. It's very important for that workflow to be seamless, and so we have to focus on that. We want to focus on medical device integration. For example, if we take vital signs, we want to integrate those directly in from the machine into the electronic health record so that we avoid any errors for people entering that data and get it more timely and more effectively. And then we have to support all of that with very robust clinical decision support. So let's talk a minute about clinical decision support and everything that we do for onboarding technology. If we really want to drive change in healthcare, if we really want to improve the overall patient care, we have to focus on the 5 rights of clinical decision support. My job as the Chief Medical Informatics Officer and our clinical informatics team is how do we provide the right information to the right person in the right intervention format through the right channel at the right time in the workflow. And we really include this in our methodology every time we look at implementing a new project or optimizing certain items. That becomes extremely important as we talk about interoperability. As you can imagine, patients in our community may be seen by other healthcare entities. And as I said, it is our patient's record. So we have to participate and partner with other organizations that allow this information to be interoperable and to allow us to know all of the information that's pertinent to this patient's care. And I'm going to tell you about two of those organizations today. The first of which is ETHIN, that's East Tennessee Health Information Network. It's a community-based regional health information exchange network. It's a 501c3 nonprofit organization that was incorporated in 2005, and its business model is really designed to share the cost of commonly needed tools in order to lower that cost for individual entities. As you can imagine, an individual physician practice, it may be expensive for them to participate and to onboard certain tools, and so we want to make that cost more affordable to onboard more people. ETHIN serves 23 counties in the East Tennessee area. It has over 1.6 million patients in the database. Over 2,800 physicians participate with ETHIN, and over 8 hospital systems representing more than 4,700 beds. And as we've transitioned to a more robust electronic health record in the past 5 years, really what we tried to focus on is how do you make this interoperable data even more integrated into the physician's workflow. So recently, Covenant Health partnered with East Tennessee Health Information Network to integrate ETHIN directly into the electronic health record. So you can imagine if a patient comes to one of our emergency rooms and they've recently been seen by a physician, or maybe had an image or a test done at a non-Covenant location. Now, when they're seen in our emergency rooms, we can go out and look in ETHIN and see that information. And it's right there in the patient's record. It's in the physician's workflow. And we've really seen this improve the ability of interoperability and ultimately helping us to have a seamless transition of care for our patients. The other organization that we partner with is Commonweal, and Commonweal is a national health alliance with over 25,000 provider sites. You can see the graph in the upper left-hand side. It has over 151 million unique individuals included in this database, and 2 billion health records are received. This is extremely important, not just for Covenant Health, but really for our community. As you can imagine, with the Great Smoky Mountains National Park and our backyard, we have a lot of tourism. And so there are a lot of people who travel here from outside of the region or outside of the state, and they may get sick while they're here. And this allows us to be able to connect with their care team in another state, find out more about their medical history, and even more importantly, send follow-up information back to their physician in their home state. So both of these become extremely important in helping us better improve the quality of life and take care of the quality of our patients. Even more exciting to me about interoperability is the patient and how the patient interacts with their healthcare data. And so I want to take a few minutes to tell you about My Covenant Health and the journey that we've been on. I talked to you a little bit earlier about meaningful use, and one of the requirements for meaningful use was for hospitals and health systems, provider offices to provide a patient portal where a patient could electronically go look at their health information. And so prior to us implementing a new EHR back in 2014, we had Relay Health. As we focus on rolling out Cerner across our health organization, we focused on designing a new patient portal, and we knew that we wanted that patient portal to go above and beyond the health record. So in 2018, we launched My Covenant Health. This is available on any website and a mobile website, but it's also available as an app, which we felt like is extremely important, if especially in today's world. I know I have tons of apps on my phone, and commonly that's how I access a lot of information that I need. And so our patients can download the app, and they can easily use face identification to navigate through their health record. After implementing My Covenant Health, we said, again, we want to go above and beyond offering the health record, and we really focused on our consumer framework. How do we help people navigate through their journey? Do they need to know, maybe they need to find a new physician? Maybe in the past couple of years, they need COVID resources. Maybe they need help knowing what insurance is accepted, or how do they pay their bill. And so we were able to add on those custom features and functionality. Also, through the ONC and other national regulatory programs who are focusing on true interoperability, one of the requirements and initiatives that we took on is connecting with Apple Health. So if you can imagine, if I am a patient that is seen by Covenant Health, but I also have a visit at a non-Covenant Health entity, I may want a place to see that longitudinal record for myself, and I may want to compare it to how I'm counting my calories, or how I'm looking at my steps, or how I'm looking at my heart rate. And so by opening up the connection with Apple Health, it embraces the patient being able to look at their comprehensive health record. And then at the end of 2020, we also realized that our community may need services and information about Covenant Health, even if they're not an established patient with Covenant Health. And so we developed a new consumer persona, which doesn't require you to necessarily have a login, but you could still download the app, and maybe you can find out how to send an electronic card to someone who's hospitalized. Or find out how to navigate through our campuses if you're going to visit a friend or family member. And through the evolution of this journey and really focusing on interoperability for our patients, we recently redesigned My Covenant Health, and this is what it looks like today. We really have feedback in our data that shows that lab results are really one of the most common things that patients look for. So how do we make those things very accessible and very easy to navigate through? And so I hope you'll like the new look and feel. We're getting a lot of positive feedback about that. I just want to touch a minute on what things are available for patients. And again, this is how technology is changing the future of healthcare. You can access your record on your phone, on a tablet, on the desktop. You can read your doctor's notes. You can read your discharge instructions. You can request prescription refills from your primary care physician or from your established physician practice. You can communicate with your healthcare team. You can send a message to your physician. You can send a message to his or her nurse, and ask questions about your upcoming visit, or questions about follow-up. You can request an appointment, and for some of our clinics, you can even schedule an appointment yourself without having to pick up the phone and call. And we also have capabilities to allow you to pay your bill electronically. So I know, you may have come into today's webinar thinking that we're really going to focus on virtual care, and I am going to transition there. But I think these other pieces are really key to how we're going to improve healthcare utilizing technology. I think one of the biggest things that we've learned is we have to have a multi-channel approach for our patients. For example, we have a call center. There may be patients who prefer to pick up the phone and call. So we're always going to have telephone. We're always going to have that option for somebody who wants to call. We may have people who prefer to do chat. And so we do have secure chat bots. Helen is our chat bot that lives on our website, and she can help you navigate through your care journey at Covenant. The other thing is we may have people who they don't even want to chat with someone. They just want to take care of these things on their own. So how do we continue to focus on online scheduling, ability to complete forms, all of those kind of pre-visit and post-visit activities? Again, making this more focused on the patient and their preferences. And now we'll get into one of the hottest topics over the past couple of years, which is virtual care. Why do we need a virtual care strategy? So these are some of the questions that we were pondering even before COVID. And the answers we had is that consumers, me included, we value convenience. I mean, I don't know about you, but I'm a working mom, and it's really hard for me to try to fit an appointment in between 8 and 5 Monday through Friday. And it may be even more difficult if I have to go leave my office, pick up my child from school, transition to a different location. So how can we make healthcare more available and more convenient for patients? Consumers value saving money, and so we need affordable ways to be able to access healthcare and communicate with providers, and virtual care can offer that. And then consumers value time back, and so these are really some of the key drivers on why it's important to have a virtual care strategy and to embed that into future plans and current plans even for advancing healthcare through technology. As we focus on advancing that delivery of care, we really went out and looked at trends in the market. And what you'll see here is in Fortune magazine, they predicted that tomorrow's office visit will increasingly take place everywhere but the office. So you can see a prediction as we get into 2024 and 2025 that physical visits volume will go down while virtual visits continues to go up. And we have seen some of these trends through COVID. I think what we learned, extremely difficult for us to go through the pandemic, especially as a healthcare delivery system and as a community. However, I think one of the things we learned is some of the barriers and fears we had with using virtual care were stripped. We're not taught as physicians, how do I use a mobile platform? Well, now everybody knows how to use some type of mobile platform. They've had to use it for work, or their child's had to use it for school. And so it just became easier to utilize these tools. The other thing that national trends have shown since the pandemic began is that telehealth and virtual care have become a must-have. So what we've seen across the market is that hospitals and health systems, as you expect in this red line, their telehealth volumes just continue to go up. Their investment in telehealth technologies continue to go up, and some other things such as urgent care or outpatient services may go down. But what's even more interesting, and what we've seen and really has been the greatest disruptor for healthcare delivery systems, is external competitors. So we're not competing with our neighbor hospital. We're competing with Amazon. We're competing with these large institutions across the nation who really saw the need for telehealth and have put a lot of technology, development, time, resources, and funding into these programs. And so we're still learning as a healthcare delivery system, how does that disruption force us to evolve more? And that's really happening across the nation, no matter who you talk to in healthcare. At Covenant, really, we wanted to focus on what is our goal for virtual care. And our goal, after looking at these national trends, is how do we provide high quality, easily accessible, affordable virtual health services that ultimately support our mission to improve the quality of life through better health. And through that, we've implemented a virtual care operations center that I'll tell you about in a few minutes. This is a snapshot of several of the services that we have available for virtual care. If you're hospitalized or in the emergency room, we are able, let's say you're in a rural community and you need to connect with a specialist in Knoxville proper. We're able to connect the doctors to the patients through using virtual care technologies, and that's what a lot of the solutions are you'll see to the left-hand side, including nephrology, cardiology, etc. We do also partner with East Tennessee Children's Hospital for our newborn nursery. It may be very easy and quick to get a baby who's here in Knoxville over to Children's, but we also service hospitals in Sevier County and Cumberland County and Hamblin County. And so how do we make sure that those neonatologists are able to intervene on the care even before the baby transitions on to Children's? And so that's been a great benefit for our community. Behavioral health and psychiatry is also a huge need. I'm sure you've seen many articles on the increase in behavioral health needs as we've all struggled with this COVID-19 pandemic. And we've seen that too. And so we wanted to figure out, how do we meet those patients in a better place? And so we not only offer consults in the ED and consults for hospitalized patients, but we have a very robust outpatient program where individual virtual care visits can be done or group therapy sessions can be done using a virtual platform. And what we've seen in using that virtual platform is, because it is more convenient, we don't have as many people no-showing and not coming to that appointment, which for psychiatry specifically is extremely important. And then on the right-hand side, you'll see several services that we offer in the outpatient setting. So if you have a scheduled visit with your physician that's just routine, we can offer that through a virtual and rather than in person. We also have many specialties across Covenant Medical Group. And we also offer virtual for oncology scheduled visits. Our next big focus in that area is, how do we drive chronic disease management, especially in using technologies like remote patient monitoring coupled with virtual care. I want to focus a little bit more on two of the recent initiatives, and one is virtual urgent care. Just like we showed in the national trends, what we've seen in this market is that people want a very convenient way to be seen. And we felt like it was extremely important to set up and offer these services. So from your mobile device or from a computer, you can access a board certified emergency medicine physician through a partnership with Teen Health, and seek the care that you need 24 hours a day, 7 days a week. And so we've seen this as a huge win for our community, and also a great way to see how technology is changing. You can imagine if your doctor's office is closed on a Saturday and something happens either to you or to your loved one, gives you a very convenient way to be seen quickly, and then connect back with your primary care physician after the visit. And what we'll see for the future of technology is, how do we couple home diagnostic kits with virtual care? So you can go to the local Best Buy or any other tech shop here in town, or look up online and purchase products such as this. This is a TidoCare device that offers you virtually for the physician to be able to see into a patient's ear, into the back of their throat, into their eye, to look and examine skin, as dermatology needs may arise. And so what we'll see in the future is, how did these tools become more convenient? How did they become more affordable? And how do we better incorporate them into our virtual care services? I want to take just a moment to talk about how we are also focused on advancing technology in the inpatient setting. This really became extremely crucial to allowing our community to get through the COVID-19 pandemic. Covenant Health saw the need to advance our ICU services with setting up a virtual care operations center and offering tele-ICU services. With these tele-ICU services, this service augments the bedside team. So we're not taking people away from the bedside. The nurse and the respiratory therapist and the physician and all the team members that care for the patient are there every single day doing the hard work that they do with the passion to be able to care for those patients. And now they have additional services to help improve patient care with 24/7 access to critical care board certified nurses and critical care board certified physicians who are helping. These physicians can see all the electronic health information. They can look at the cardiac strips. They can camera into the room and be able to speak with the patient, speak with the nurse, be able to zoom in and look at the drips and look at the ventilator settings and all of those items. And the reason that we set up these services is these have been shown in national institutions such as whether it be the Cleveland Clinic or other institutions that have a large present of on-site critical care expertise. Tele-ICU still shows to improve the overall mortality and overall quality of care for our patients by helping patients transition through the ICU more smoothly, getting them off the ventilator earlier if they're well enough, and preventing hospital acquired conditions. So we've seen this as a huge advantage, especially, as I said, in our outlying communities, we didn't have as many people who needed to transfer in to our Knoxville hospitals, which was extremely important in a time where we really had no bed availability across our community. And so here's one of the ways that technology is going to continue to advance healthcare. We're going to continue to need to have hubs that serve patients no matter where they are and provide that expertise, even if the expertise is not there in person. Through our partnership with the Virtual Care Operations Center, we knew we needed to house us at a place that had 24/7 power, that had high reliability. It needs to be up and running at all times. And Covenant Health is proud to announce that we have formed a managed services company here in Knoxville, which is a data center as well, called 10 Hats. And I hope you've heard about this. If you've not, I'd love to connect you with our team. They offer a multitude of services, but one of the greatest things that we have is a data center there. And that data center is able to keep our information secure, keep it reliable, all of those things that are extremely important for businesses in general, but also even more important when we're talking about improving a patient's care. This is a very significant investment for our community, and it's also a significant need for the community. The great thing is we've had auditors and surveyors come in, and they have toured our data center, and they have made comments to our team that this is the most unique data center in a 250-mile radius. And so we're very proud that we are able to offer these services, and we're excited that we can also continue to expand our virtual care operations center in this location. As we continue to focus on advancing healthcare with technology, we also have to focus on digital advancement. So not just, it's important that we look at the whole patient journey. We start very quickly looking at the episode of care. So how do I use technology for that face-to-face visit for a provider and a patient? But it's really important to take a step up and look at the overall journey. How do we push brand awareness and make sure somebody knows who Covenant is? And then once they onboard and maybe they interact with us and schedule an appointment, how do we seamlessly take them through those pre-visit activities? And then once they've had their encounter, whatever the encounter may be, how do we walk them through that post-visit journey as well? And we really aim to do that using technology. And again, our goal is how do we make this not just a seamless patient experience, but a seamless digital experience. And that's our goal. We're not there yet. I don't know if any health system's there yet, but that's where we're headed. And we're investing in technologies. We're investing in custom work to be able to make this to accomplish this for our patients. Again, I talked to you about this a little bit earlier, but what we've learned through this journey is you've got to meet a patient where they are. And part of that is having a multi-channel approach. So we do, again, have a call center that helps patients navigate through their care. We use secure chat, which I'll talk to you about a little bit more. And we also have online options. And again, what we've learned through this is you need a multi-channel approach, but the communication's got to be clear, and you've got to have follow-up messaging that occurs as well. So I'd like to introduce you to Helen. She is our secure chatbot that lives on covenanthealth.com. And she is there to help patients navigate through their journey. At the very beginning of the pandemic and the March to April timeframe of 2020, what we saw is that people were scared. They were being instructed to not leave their homes. They were scared to go to their doctor's appointments. They were scared to come to the hospital even if they were sick. And so we thought, how can we connect with them? So one of the very first things that we did is we built out the CDC COVID-19 check, which allowed patients to navigate through and answer questions and determine if they needed to go on to the next level, see a provider, and then later on be tested for COVID as our journey with COVID evolved. We put a team of nurses behind this secure chatbot. So again, with that multi-channel approach in mind, we start this flow with a secure chat, and if preferred, we can end it with a secure chat. But there are times that it needs to transition on to a phone call, and we're able to connect the patient on with a nurse. And then if needed, we can even connect them onto a physician and have a virtual appointment. Since that time, we've really built out a lot of this technology, more focused on how do we help patients navigate through their healthcare journey. And so we continue to learn and to grow Helen in more ways. We want these tools, again, to be really focused on patient experience. So we knew in the beginning they have to be intuitive. They need to be convenient, and they have to be mobile optimized. And so it's important that we have partners, and also that our internal team works on technologies that meet these needs. And so here you can see an example of our COVID-19 vaccine scheduler through a partnership with Radix Health and Relations. That we have been able to provide to the community, and we are offering other services through that tool now. And so I think you're going to continue to see more and more of these advancements that are going to change healthcare trends. So let's talk for a minute about mobile adoption, because I think this becomes very, very important in a patient's care journey. The first thing we looked at is national trends. So these are the percentages of U.S. adults who say they have or own the following. So this is smartphone, and as you can guess, our younger demographics, this number is extremely high. But what you'll see is that there's also above 65, 61% say they own a smartphone, and between 50 and 64, 83% say they do. And so we started to use these national trends to say, how do we want to hone in on Covenant Health data to see where we need to focus on advancing the technology. And so what you'll see on the right-hand side is a snapshot of our My Covenant Health demographics. You'll see that we have a higher percentage of females, which is not uncommon, because lots of times the female not only takes care of her own health care, but she may help her parents, she may help her children navigate through that journey. And so I don't think that that's unusual for Covenant. That really is what we see across the nation from healthcare. The other thing that you'll see on this right-hand side is we have a pretty wide distribution of age ranges. So I will say, prior to COVID, we had a lot more patients in the 55 to 64 and the 65 plus age range. I think what we've seen with COVID is we've had further adoption of the 35 to 44 group, mainly checking their COVID-19 testing results and having quick access to those items. And then in the bottom, I think one of the things that was probably surprising for our team in the beginning, and now we've learned more, is that despite having demographics in every age range, we have an extremely high percentage of mobile users. So 66.5% are accessing My Covenant Health through a mobile platform. And then 30% on the desktop and the smallest percentage on a tablet. And so that really helped us, our team, say, if we want to change the future of healthcare, we really need to focus on mobile strategies. And we need to make these, again, intuitive and seamless tools for our patients. Again, our goal is to provide technology-enabled integrated healthcare delivery, no matter the venue of care across our healthcare delivery system. And so that's the journey that we're on. I cannot talk about the advancement of technology in healthcare without spending a few minutes on diagnosis and treatment. I will say that this is probably the area of medicine that has been most on the cutting edge from a technology standpoint. As you can imagine, advanced imaging technologies, procedures that we do. This is an area that has always been a leader in technology from a healthcare industry. But I want to talk to you a little bit about how I think that will change over the future. So Covenant invests in local communities, and we offer innovations using technology, such as robotic-assisted surgery, which is one example of how technology changes healthcare. We also are the region's only stroke hospital network. And so we have a comprehensive stroke center at Fort Sanders Regional Medical Center, and we're able to connect those patients in the rural communities to the neurohospitalist for very quick and timely care, which is extremely important if you're focused on outcomes for stroke. And then we also focus on items for procedures. So one of those is the TAVR procedure that we use for our cardiac patients. And Park West has been recognizing for completing over 1,000 procedures in this area. And we've also been recognized by Fortune and IBM Watson Health as a top 50 cardiovascular hospital. And that is by using technology, incorporating that into our healthcare model. The way I feel like this changes in the future is we're going to continue to focus, and funding and investment is going to go into improved testing. It's how do we transition to preventative care? How do we get ahead of these diagnoses? And so lots of funding going into how do we develop more comprehensive tests. As you can imagine right now, for cancer screening, which is extremely, extremely important, we have lots of different modalities, lots of different tests that we do to screen based on your gender, based on your age. How can we make that even more convenient, even more accessible for patients, and maybe combine some of those items? So I really believe that that's how technology is going to help the future of healthcare in the world of diagnosis and treatment. I think the other big thing is continuing to advance with state-of-the-art treatment modalities. So not only is it extremely important to identify the health condition early on, no matter what it may be, cancer is just one example. And then once we are able to diagnose, how do we give the most sophisticated state-of-the-art treatment modalities and options? And so I think that's how technology will play a role in the future of healthcare for diagnosis and treatment. And then I want to talk about, really what's on the horizon for technology in healthcare. We talked earlier about clinical decision support and its importance in helping clinicians and providers better care for patients. And I think what you'll see is over the next few years, and probably for many years to come, is how do we expand that clinical decision support using artificial intelligence? So again, this is how do we get more predictive measures using AI and feed that up to the physician in the right part of their workflow so that they can make the best informed clinical decision for our patients. And I think you'll continue to see lots of advancements in that area. Also, our vision at Covenant for advancing technology and care is imagine a day where all specialty services are available to every patient, regardless of their location. That's what we want to be able to achieve for our community, and we'll have to use technology to get us to that level. We will do that by really focusing on the virtual care operations center expansion. And so again, what this allows us to do is to have technology-enabled solutions with clinical expertise, utilizing predictive analytics and virtual care to better serve our patients. And I think you're going to continue to see that evolve and increase across the nation as we improve the healthcare system. The other thing I think you're going to continue to see more and more of is technology in the home. How do we care for patients in their home environment? Whether it be I have congestive heart failure and I need to manage my heart rate and my fluid intake and my weight and all of those items and get them to the doctor more timely. Or it may be, I need to be seen for an emergency room visit. I need to be seen for a hospital stay. You're going to continue to see more and more advancement of the technology to enable us and allow for us to care for patients in their home setting if that's what they prefer. Of course, our hospitals are not going away. We will continue to have our brick and mortar entities that care for patients, and they're going to be critically important to the future of healthcare as well. But we want to focus, again, to meet the patient where their needs are and where their preferences are. I think the biggest thing that we also have to focus on as we think about what's on the horizon is what's beyond the COVID-19 pandemic. I love this picture because it's, of course says objects in mirror are closer than they appear, and they are. We as a community just came out of 3 huge surges of COVID-19, and we learned a lot through that endeavor. What we're faced with now is how do we take those learnings and incorporate them into improving the care for our patients? And I really think technology is going to play a key role in that. As you've seen across the nation, we've had a lot of people leave the healthcare industry. They just said, I can't do this anymore. The burden's too heavy. And so as we all face those challenges, no healthcare entity, I think, has been able to hide from that. But as we all face those challenges, we got to think about smarter ways. How do we do this better? How do we use the resources at hand to improve, but also not forget where we came from? And I believe the way we do this is we have to have a mature approach to innovation and our requirements. So sure, it's really fun to go out and get the newest technology and implement it, and you want to be able to innovate, but unless you have these core components, it's very difficult to innovate. So you've got to have a local data center. You've got to have a place to secure or some type of remote hosting where your information is in a secure place that's easily accessible and it's reliable. You've got to focus on your network. You've got to have the right hardware, and your systems have to be performing. If our electronic health record is not up and running, it doesn't really matter that I go work on optimizing a certain section of it. So we've got to first focus on that core foundation and functionality from an IT perspective. The next layer is our application. So we have to have a core electronic health record, and it's got to be sustainable. We need our patients and our clinicians to be able to trust that they're there, they're reliable, they're available. We have to focus on biomedical advances. How do we make sure that data is no matter if we're putting in a pacemaker or we're using a machine to take vital signs, we have to be able to embed those items and connect them to the core electronic health record. We have to be able to use tools to focus on digital advances, whether that be our virtual care platforms or it be communication platforms that help us allow patients to navigate through their journey. And if we have all these things in place, then it becomes easier, I'll say, to focus on innovation. And really, that's what we're aiming to do. As we focus on innovation, what we like to say across our Covenant Health IT family is it's our job to make it or IT happen. And that's what we'll continue to focus on for years to come. Ultimately, using that passion to continue to put our patients first and to improve their overall care through technology-enabled solutions. Again, I want to thank you so much. Thank you to the Knoxville Chamber for allowing myself and Covenant Health to present today. I'm excited that you attended. I hope that this was helpful for you. And certainly if you have any questions, I'd be more than happy to take those.
Thank you, Dr. Halford, for sharing such great information with us this morning. It was a fantastic presentation, and I think we're going to make time for one quick question. So here it is. How are you thinking about outreach and getting patients to engage with all of this great technology?
Yes. So access and outreach is extremely important. And I think we have to look at all of our demographics. We have rural communities, we have senior populations. And so I think based on the population and based on what their need, there may be a different way that we need to tackle that outreach. I think the first thing is having them know that Covenant Health is available. Here are all of the services that we provide and giving them one channel in to be able to help them meet their needs. For example, the call center, they don't know how to do every single thing around Covenant Health, but what they know how to do is to connect the patient with the right resource to help them get engaged. And so that's where we partner with our patient experience and marketing teams to really help patients with access.
Wonderful. Well, thank you so much. I know that I certainly learned a lot this morning, and I hope that our attendees did as well. We are certainly appreciative of your time and lucky to have you in our region. I'd also like to take this time to thank the Chamber's Economic Development Ecosystem sponsors again for making this program possible. The Chrisman Company, Mesa and Associates, First Bank, and McCarty Holsapple McCarty. We appreciate your support. And of course, we'd also like to thank our investors. We couldn't accomplish the work that we are accomplishing without your support and help. Thank you to everyone. Thank you again, Dr. Halford, and have a fantastic rest of your week.
Thank you, Ashley. Hope everyone has a great day.